Okay, I am doing male catheterization. So I would begin entering the patient's room, introduce myself, close the door, provide privacy, get 2 patient identifiers, name and date of birth. Then I would explain the procedure to the patient, inserting a catheter, and then ask the patient's pain level, make sure that they're comfortable, and provide hand hygiene. Then I would raise the bed and have the patient lay supine with their legs apart and their knees up. And then once the patient is in position, I would get all my equipment ready. I have my catheterization kit here. I have my bag that it came in over here for garbage. And I have my water bottle to do the demonstration. So then I would open my kit. So I would begin away from me, only touching the very outer inches. If this were to fold back on itself, it would be no longer sterile. Okay. I'm going to first grab my gloves, and there is a little bit of iodine on the packaging since I've already opened up my iodine when I was practicing. So I'm just gonna keep it right here on the edge of this just so I don't get iodine on the bed. However, I would keep them usually in separate sterile fields, not touching. I'm going to open this, and then I will put on my sterile gloves. Okay, now I can move that. I would just push that off the table. Then I am going to grab now this also has iodine on it, so I don't want to lay it down, but I would open this up, keeping the blue side down, and put this underneath the patient as it chucks or something to collect any water or urine that just drips down. So I would just set this over here on my patient, slide it under, and being sure not to touch the patient when you do so. Then I will take this part out. So first I would open up my iodine, which I've done, and I'm just gonna set it here. And then I would open up my lube, which I've also done, and I have placed my lube on the edge of the tray. Now I'm going to take out my catheter. I'm going to connect the syringe to the catheter so that it is ready. And I'm going to lube up the bottom half of the catheter. Okay. All right. Once my catheter is lubed and my syringe is attached, I'm going to just set that down so it'll be ready for insertion. Then I would grab my iodine here, swabs, and there are 3 of them, so I would take it out, swab, and these would go into that garbage. And then I would take the next one, swab again, and then again with my 3rd one. All right. Now that it is clean, and you would also perform peri-care before inserting if needed, depending on the patient. But once it is clean, then I am ready for insertion. So I would have the patient take a deep breath, and I would insert the catheter in, and then when urine starts to flow out into the bag, go about 1 to 2 inches more. Okay, so we'll set this like this. That's in now. And now, once it's in the patient, I would inflate it. So I'm going to insert the water. Well, I've been having troubles. I cannot get the balloon to inflate, and I've been trying like all day. I don't know if there's something wrong with my catheter. Okay, well, the balloon would inflate normally in there, and it just keeps dripping out around it. So I'm just gonna set that down. However, your balloon would be inflated inside, and that would prevent the catheter from pulling out of the bladder. So once it is inserted, then you just place the bag attached to the leg and attached to the bed. Give patient teaching, tell the patient not to pull on the indwelling catheter or to let the tubing get any kinks in it, because then it'll block the flow of urine. Then I would assess their pain level, again, dispose of my materials, and then provide peri-care to the patient. Get them comfortable, lower the bed, give them their call light, document the size of the tubing, what size catheter I used, what brand, if it was a indwelling or a straight cath. I would document any urine that came out, how much, and then the color and if there was an odor. I would document, I think that's about it. And then take off my gloves, perform hand hygiene, and then I would leave the patient's room. Okay, I'm going to do my removal now. So I was able to get the balloon to inflate in here, so it is inflated in the water bottle now. Okay, so for my removal, I would knock, enter the patient's room, introduce myself, get 2 patient identifiers, name and date of birth. Then I would check the patient's pain level before the procedure, lower the bed or raise the bed, get the patient in supine position again, legs up with their, or knees up with their legs apart. And then I would perform any peri-care if I needed to before, and then I would go in for my removal. So I would not need to have on sterile gloves. However, I have on my sterile gloves from the insertion, but I would just wash my hands and put on regular gloves. Then I'm going to go in and use the syringe here to get the water back up from the balloon. Okay. And now that that is empty, I can take that off, put that down. And then once it is empty, I'm going to slowly remove the catheter from the patient and checking the integrity of the catheter when it comes out, making sure there's no discoloration in the tubings or any perforations or anything. Then I would dispose of this. I'm going to just set it down for now. I would note the characteristics of the urine, color, odor, how the patient tolerated the procedure, their pain level after. That would be it, I think. Document maybe the sizing of the catheter again, if it was already, not already documented. And then lower the patient's bed, get them back into a comfortable position, provide them with the call light, perform peri-care afterwards. And I would also, for the removal, have a chucks or something like this placed under the patient the whole time too, just in case there was anything, urine or water spilled. Would remove my gloves, wash my hands, document, and provide call light to the patient, and that would be all.